Okay, so this is part two of the reproductive system. If you watched the video in between, then you saw the different kinds of morphology that sperm can have, and it's actually 60% is the normal number. So if a man has 60% sperm with normal morphology and normal forward motion, then that's considered good. Um, so if you take a look at this picture here, this is an SEM of a seminal vesicle. I'm sorry, seminal vesicle, seminiferous tubule. And we have the developing sperm in purple. We have the flagella in yellow here. And then I have some numbers. So the normal volume of an ejaculate is 1.5 to 5 milliliters. The sperm inside ranges from 20 to 150 million individual sperm per mil. So if you multiply the low ends, you have about 30 million sperm per ejaculate, and the high end, you have 750 million sperm per ejaculate, which is very staggering numbers. So, animals are very good at reproduction. That's how we colonize the planet. And the gametes, right, play a critical role in that. All right, so let's take a look at the next topic, which is the epididymis. So this you can see is the testis, and we have the coiled seminiferous tubules within our lobules. This is our tunica albuginea. So when the sperm are being created here, they're going to move progressively towards the epididymis, which is this region here. So this is a structure that's sort of on top. And so on the superior pole, we call this the head. And then we have the body that hugs the posterior side of the testicle. And then we have the tail on the inferior end. So the epididymis is about 20 feet long, pretty long coiled structure. And it's going to receive the spermatozoa. The head is, right? So we can see that we have this collection of tubes called the reedy testis. This is not in your notes, you don't need to remember that. But it's going to allow the sperm to move in here. So this epididymis is where the sperm are stored and matured. So when they are initially formed within the seminiferous tubules, they're not yet ready to fertilize the egg. So they do need some time within this maturation process takes place in the epididymis. So you have long stereocilia here to help propel the sperm. The epithelium is pseudostratified columnar tissue. And so they're going to gain their ability to move their flagella and mature. And so this takes about 2 weeks and or several months. They can just be stored there for several months if there's not an ejaculation event. And then when the sperm mature, they're going to move from the head to the body to the tail. So during ejaculation, the sperm in this region is going to move up this tube here. So this is called the ductus deferens, otherwise known as the vas deferens. And this structure will take the sperm up into the pelvic cavity where it can pick up the fluid known as semen. So let's look at letter C, their spermatic cord, and letter D, the vas deferens and ductus deferens. So I just pointed out letter D, right? The vas deferens or ductus deferens is this structure right here. But let's take a look at the spermatic cord. And I do have to move all the way up to one of the first original pictures to look at this. So here it is. All right, so if we look at the box that says spermatic cord, it's going to be a bundle of structures that travel together. It's going to contain the ductus deferens here, which is going to move the sperm. It also contains arteries, nerves, and lymphatic vessels. I'm not going to have you guys learn exactly the specific name of these arteries. Testicular arteries, not too difficult to remember, but the only one I want you to know is ductus deferens by name, and then also know that there's blood vessels and nerve. So they're going to be bundled together. So you can see that they're running through the inguinal canal. And this side here shows the cremaster muscle taken away. So the cremaster muscle also is on top, superficial to the spermatic cord. Okay, so we have running through the inguinal ligament here, we have the cremaster muscle and we have the spermatic cord. So if you watch the ductus deferens, it's going to come up through the superficial ring, enter the pelvic cavity by exiting through the deep ring of the inguinal canal. It's going to go posterior to the bladder. So now I'm going to move to another image. I'm going to pause it. So here you see an actual spermatic cord, and you can see the epididymis has been opened to see the coiled, the tubes of the epididymis, and then we can see the entire spermatic cord. And it's very difficult to tell the ductus deferens from anything else, but it is there. Okay, let's take a look at when the ductus deferens, here it is, comes to the posterior bladder of the male. It will widen, and this area is called the ampulla of the ductus deferens. And then when the sperm is traveling towards the ampulla, there are 3 structures that secrete semen. So the 3 are the 2 seminal glands. So there's one seminal gland, here's another seminal gland, and then there's the prostate gland. So if you look at the accessory glands, letter E, we're looking at number 2 and number 3 at the moment. So the seminal vesicle, otherwise known as seminal gland. So in your notes, it's seminal vesicle, which is an alternate name. This produces 60 to 70% of the semen. So most of the semen is produced in these 2 glands. The substances in semen, there's a lot of different kinds of chemicals. I listed just some. There are neutralizing substances that can neutralize the vagina. So the vagina is slightly acidic. The acid that is set up in the vagina is meant to be protective, so that it's kind of a hostile environment for pathogens. And so it's sort of more difficult for an infection to take place or to take hold in the vagina. If a woman is pregnant, right, the vagina is basically the gateway into the uterus, and it could harm the baby if she had an infection. So the acidic environment sets up sort of a protective barrier to outside infection. It's also hostile to sperm, and in fact, some infertility reasons why people can't get pregnant is that the woman's vagina or the woman's immune system will actually destroy the sperm. So there is a neutralizing substance in the semen, so it can help to enhance the survival of the sperm in the vagina. It suppresses the immune response in the female reproductive tract. There are some proteins there. There's fructose. So fructose is a sugar. And if you remember, the sperm in the middle piece had mitochondria. So mitochondria makes ATP, but it can't make ATP from scratch or from nothing. It needs to metabolize sugar, so that fructose is the energy source for the sperm. There's vitamin C, there's zinc, all nourishing properties, like nourishing substances for the sperm, because the sperm can actually live in the reproductive tract of a female. I think I've heard 5 days on average. I've heard as long as 7 days. So it needs to be able to survive, and that's the semen that coats the sperm is going to enhance that survival. Then the prostate gland also secretes substances that contribute to semen. So there's 2 seminal glands, 1 prostate gland. So when the sperm come in through the ampulla, it will enter into the ejaculatory duct. So this is a very short-lived region, but it's going to overlap with the semen coming through. So the semen, there's smooth muscle in the walls of these glands. They will contract and push the semen into this ejaculatory duct. At the same time, the sperm is coming through. So these actions need to be coordinated. And so then, of course, the prostate gland will also contract and secrete substances into this ejaculatory duct. The ejaculatory duct, when everything mixes together, then it's going to come into the prostatic urethra. And then, of course, then it's just out the penis. So we're going to enter the membranous urethra, and then the spongy urethra, and then external, right? So that's basically the accessory glands here on the posterior side of the bladder. Let's look at number 1, which is called the bulbourethral gland, or otherwise known as Cowper's gland. So here it is. So this is another structure that's found in the urogenital diaphragm. So the bulbourethral glands secrete something called pre-ejaculate. So it's a substance that comes from these glands before ejaculation. And these substances are basically just to clean the path of the urethra for the sperm. So if you think about, for the male, the urinary system and the reproductive system overlap. And so the urine can contain many harmful substances and, just molecules and substances that are not going to be healthy for the sperm to pick up as they move into the female reproductive tract. So the bulbourethral glands will secrete a substance to sort of wash the urethra before ejaculation. Okay, so they're located right here inside the urogenital diaphragm. All right. So this is a look at everything together, right? So we have the testis, the gonads, where sperm is produced, the epididymis, where sperm is stored and matured, and then during ejaculation, the sperm will move up the ductus deferens, going posterior to the bladder. We see it in a wide ampulla. It will pick up semen from the seminal gland and prostate gland. Here are the openings to the ejaculatory duct. So once the semen and the sperm have mixed, then it comes through these two openings and overlaps with the prostatic urethra, and of course, then we're moving out the penis. In the process known as a vasectomy, I was trying to search for that word, a vasectomy. What that is clipping. You can either sever the ductus deferens or maybe pinch it off. I'm not actually 100% sure. I think there's reversible and irreversible vasectomies, but they will basically just cut off the route where the sperm enter. So if a man has a vasectomy, the sperm will still try to come up during an ejaculation, but it won't finish the path because it's going to get stopped. However, the man will still have an ejaculate because the semen up here in the pelvic cavity will still be made, and the semen will actually still exit, but the semen will not contain any sperm. Let's take a look at the penis then. So externally, the root of the penis is going to be attached to the body wall. I'm actually searching for the root, but it's not in this picture. The shaft or body is the free portion. This, what you see here in this picture, the bulb and these branching parts, this crust, this is internal. So this is within the pelvic wall. And then the body of the penis, or the shaft, is the free portion, and then the glans penis is the distal end of the penis. So you can see the glans is enlarged, the distal end. The glans penis has a prepuce. So the skin that comes over the glans is called the prepuce. You may have heard foreskin. Either term is fine. And this is oftentimes removed with a process called circumcision. So circumcision is an optional procedure, and oftentimes this is either religiously motivated or sort of a conventionally or customarily motivated procedure, but it's not something that needs to happen. It does not enhance a man's health or enhance the probability that there's no infection occurring later. So it's an optional procedure. Okay, so in this image, you can see that there's two colors here. There is this red tissue called the corpus spongiosum, and there is the purple tissue called the corpora cavernosa. I'll just introduce that. The corpus is the singular word, so there's only one corpus spongiosum, but there are two cylinders of the corpora cavernosa, which is why corpora is the plural form. So let's actually take a look at, prostate gland. I forgot to mention this. So the prostate gland, sorry about this rude interruption here, but there is very difficult, so prostate cancer and prostate health does become an issue as men age. The prostate gland can get enlarged, infected. Cancer is quite common with the prostate gland. So in order to detect the health of the prostate gland, there is a digital exam because the prostate gland does rest right against the rectum wall. So the physician would have to go through the rectum to sort of press on the prostate gland to make sure that the texture and the size is okay. So this is a checking the prostate gland. I'll mention another thing. I'll move away from this so you don't have to look at that. So this is another look at where the prostate gland is, right? So here's the prostate gland. There's the rectum wall. Let's take a look at the image here. So this is kind of a nicer thing to look at. One of the signs of prostatitis, or an enlarged, inflamed prostate gland, is difficulty in urination. And so the reason why it's difficult for a man to urinate is because as this gland enlarges and swells, it will compress the prostatic urethra, right? So this lumen will get narrower and narrower as the tissue enlarges, and it's going to be difficult or painful, or you have burning sensations with urinating. Okay, so again, and you may have also heard the prostate gland is a difficult gland to take out or do surgery on, because if you look at the position, it's very sort of tucked in between all these tissues and through muscle walls. So there's not a good access point to easily remove the prostate gland. You don't want to go through the wall of the rectum. You're going to destroy the rectum wall. And so going in, in different ways, it's very difficult. So a lot of times if men have prostate cancer, it's a slow growing cancer, and they'll oftentimes just leave it alone. And the very, very last resort would be to try to surgically remove any tissue from the prostate gland. Just the position of it is very, very difficult to access. All right, so let's take a look at the penis slide. So you're going to have the penis histology image. So this is the penis, and this is a very recognizable slide. So this, I think, should be easy for you guys to recognize that this is the penis. Now, let's look at the two cylinders, right? So here's one cylinder here. Here's another cylinder. So those two cylinders are the corpora cavernosa. And then we have the one cylinder here of the corpus spongiosum. Now, remember the urethra runs through the corpus spongiosum, which is why it's called the spongy urethra. And then here is the urethra, right? That opening here. Now, this does look like a face. If you think it looks like a face, it does. But there are going to be two very deep blood vessels found within the corpora cavernosa. So with erection, when a man has an erection, it's basically this spongy. So the corpora cavernosa and the corpus spongiosum is very spongy. It's let me show you the way it's drawn here. There's a lot of spaces within this tissue so that it can fill with blood. So in an erection, the penis does fill with blood. And so these deep arteries are going to bring that blood to the corpus cavernosa for an erection. Other tissues that you want to know, obviously the outside of the tissue will be skin. So if you looked very, very closely at this outside here, you would see, the epidermis and the dermis of skin. But really all I want you to know is that you have these two cylinders. They're called the corpora cavernosa, the one cylinder here, and then you have the spongy urethra. And then you should also know that, right, the urethra, this is the urinary system. The urethra has transitional epithelium. So if you zoomed in on the lining of this urethra, it's going to be transitional. All right, so that's basically it. So you can see also we have large veins. So after an erection, the blood is drawn back to the body through these large veins. And then here's another image. And then this is the cross-section of the penis. So you can see the very spongy tissue of this organ, and then you can see the spongy urethra here. Okay, so in this side view, the mid-sagittal view, we have we can appreciate the actual sizes and textures of the tissue. We can see the two tissue types. The corpus cavernosum is this structure here, and the spongy urethra with the corpus spongiosum is here. So if you look at a side mid-sagittal view, the corpus cavernosum is on top. So you're only going to see one. So this is the corpus cavernosum tissue, how it's illustrated, and then the groove, when you see the groove, you know that's the spongy urethra, so the tissue around that would be the corpus spongiosum. We also see here, we can see the bulbourethral gland or Cowper's gland here that is embedded within the urogenital diaphragm. We know that the external urethral sphincter is also here along the walls of our urogenital diaphragm that are going to surround the membranous urethra. We have the prostatic urethra leading to the bladder. This is our ejaculatory duct, right? This is the ampulla of the ductus deferens. Just follow it with your finger or with your eye to make sure it's the ampulla of the ductus deferens and not the seminal gland, which is next to it. And I think that's all we need to talk about. The pubic symphysis, the bladder sits behind the pubic symphysis, right? And then we have the prepuce or the foreskin. And I think that's it. So you want to be able to label everything in this picture. Obviously, there's not a whole lot here. I think we're done with the male reproductive system. Right, so we're going to start with the female in the next lecture.